Hi doctors, welcome to the new episode of our A to Z series where in each episode alphabetically we discuss one of the most repeated previous year topics of INI-CET, NEET PG and FMGE, and our today's episode is episode R where R stands for Raynaud's phenomenon. So let's begin our discussion with solving a previous year question. A 17-year-old woman with no comorbidities present with numbness and paresthesia of the fingers, along with the characteristic finding as shown in the image above. She has no history of smoking or history of other illnesses. She mentions the episode occurs when she is under excess stress or during cold temperatures. What is the most likely diagnosis? Option A, Raynaud's phenomenon. Option B, Burgess disease. Option C, atherosclerosis. Or option D, peripheral artery disease. So which option do you think is the correct one? Well, yes, option A, Raynaud's phenomenon is the correct answer. Now let's move ahead and understand what is Raynaud's phenomenon. Raynaud's phenomenon is a condition characterized by episodic vasospasm of the small arteries and arterioles, typically affecting the fingers and toes. The causes are divided into primary and secondary. Primary Raynaud's phenomenon occur without an underlying cause and is more common. It is often referred to as Raynaud's disease, whereas secondary Raynaud's phenomenon is associated with an underlying condition or disease such as connective tissue disorders, rheumatoid arthritis, certain medications, occupational exposure to vibration, etc. Symptoms: episodes of color change in the affected area. Pallor, affected area turns white due to reduced blood flow. Cyanosis, affected area turns blue or purple due to lack of oxygen. Erythema, affected area turns red as blood flow returns and blood vessels dilate. Numbness or loss of sensation in the fingers or toes, tingling or throbbing sensation, pain or discomfort, coldness or sensitivity to cold temperatures. What triggers Raynaud's phenomenon? Exposure to cold temperature, emotional stress or anxiety, vibrational trauma. For diagnosis, first we have cold stimulation test, placing the hands in cold water to induce a Raynaud's attack and observing the color changes. Or we have nail fold capillaroscopy, microscopic examination of the capillaries at the base of the fingernail to assess for abnormalities. Treatment include lifestyle modifications to minimize triggers such as wearing warm clothes, gloves and avoiding exposure to cold temperature, stress management techniques, in medications, calcium channel blockers to relax blood vessels and improve blood flow, vasodilators, topical nitroglycerin cream applied to affected areas to promote blood flow. In severe cases or secondary Raynaud's, treatment of the underlying condition may be necessary. So that's all for today. Thanks for watching and see you in the next episode, which will be episode S.